Welcome to the Birth Squad podcast. If you're riding with the squad,
hey fam!
And if you're new,
welcome to the squad. We're your hosts, Dr. Ijama Okwando and Dr. Kanisha Thomas. We're two licensed obstetrician and gynecologists, as well as best friends.
The Birth Squad is a podcast for birthing individuals by two Black female physicians who use stories from real women to educate about pregnancy, birth experiences, reproductive health, and all things in between.
And while we hope that you love learning from our podcast, it is not intended to be a substitute for medical advice, diagnosis, or treatment. So please consult your healthcare provider for your specific care. And to learn more about us and about the podcast, please follow us on Instagram at The Birth Squad. And also check out our website, thebirthsquad.com.
Please keep in mind that some of our episodes may cover topics that could be triggering to some individuals. Listener discretion is advised.
Meet Dr. Nicole Christian-Genius, aka Dr. Nikki.
She's the next badass birth warrior who will share her story to help the squad navigate through the complex and inspiring journey of pregnancy, labor, birth, and motherhood. In this episode, we are talking about what it means to be a midwife and have a stillbirth. We understand that some of this information may be triggering. Listener discretion is advised. During the interview, you may notice some medical terms or jargon, but don't worry, we got you. We have included definitions and explanations in the episode description, so please listen up and enjoy her story. Well, welcome back to another episode of the Birth Squad. We are super excited for this episode. I am honored and privileged to interview someone that I have had the pleasure of working with, and that is Dr. Nicole Christian-Genius. Also, she goes by Dr. Nikki. She is unicorn, a certified midwife, got also a doctorate in midwifery, and is one of two Black midwives to have accomplished this. So please enjoy every piece of information that she shares with us and listen up, because she has, I'm sure, a lot of wisdom to share and a lot of experiences to share with us.
Thank
so
you,
welcome,
Dr. Thomas.
Nikki.
Happy to be here.
So we'll start off by asking you to tell us about yourself and how you became interested in being a midwife.
Like you said, I am a certified nurse midwife, one of only two Black women in this country to hold a doctorate in midwifery degree. And I became interested in becoming a midwife growing up as a child, hearing my mother share stories about her grandmother, who was the town midwife. My mother was deathly afraid of blood. And so when she would be invited to go to these births, she was like, oh no, but her grandmother would sort of make her go. So hearing these stories fascinated me. It was just something that linked my mother and I as well, even though she was totally afraid of the gore of it all. She was sure to capture the gifting of it all. How my grandmother would grab her bag and grab herbs from a counter that was like in the kitchen windowsill and, would scurry off to someone's house and jump right in this sort of mother role over the mother who was birthing. So it was just a beautiful thing.
I understand, in addition to all of your accomplishments, that you also are a mother. Can you tell us about your personal pathway and journey to motherhood?
My first child was conceived and born in my senior year of my pre-med course. But my senior year, that April, I gave birth to one of the best gifts that God ever gave me. That process of mothering him, I was hungry for knowledge. I didn't know anything about the birthing process. So I studied a lot. In that studying, I learned that I could do this naturally if I sort of set my intention on that. And if I sort of honed in my perspective that at the end of this process that probably is going to be very painful or unlike anything I've ever experienced, I'm going to get this wonderful gift, right? So that was where I was. And so I was very much in labor with him for 17 hours. He was 41 weeks and 3 days. Even during that pregnancy, I had preeclampsia. And then the next pregnancy I had was complicated. At 27 weeks, I was diagnosed previa. I had no bleeding. And back then, again, they put you on bed rest. So I was home on bed rest, not moving. 10 weeks later, they said the previous sort of resolved. So I actually went back to work at 37 weeks. And at 39 weeks and 5 days, I went into natural labor. Labored at home. I was smart then. I was a labor and delivery nurse. So I was like, I got this. Laid out in the bathtub and just sort of really went into this space of like I went inward, and it was so beautiful. Laboring at home, it was beautiful. But when I felt like it was time to go to the hospital, I did. So when we got to the hospital, as it turns out, there was no heartbeat on my full term daughter. And so that whole whirlwind of processing that, I mean, it's pretty impossible to process that in that moment. But some of the things that crossed my mind, I was like, I, I don't want to do this. I don't want to be awake for this. I begged for a C-section. I was 9 centimeters when I got there. I begged for general anesthesia. Like obviously nobody was going to do any of that. And birthed my full-term baby girl. Yeah, it was that. And then the last pregnancy was my baby, who's now 20. And again, it was a very stressful, complicated pregnancy with the hyperemesis, but mostly with the crushing anxiety of would this happen again? From 8 weeks until they finally put me out of my misery at 37 weeks. Yeah, it was crushing. I was in preterm labor with him from 27 weeks to 37 weeks, sort of stayed 3 centimeters, contracted all the time. And I'm sorry, largely I know that was due to stress and anxiety, but birthed a healthy baby boy at 37 weeks. Those are my birth stories. They were all natural, never had an epidural, never had any. So I did practice hypnobirthing with my labor with my last child. And that was pretty amazing. Though the pregnancy was very anxious, the labor and the birthing of him was fascinating.
Wow, thank you to Nikki for being vulnerable and sharing each of her birth stories.
Let's take a moment to discuss stillbirth.
Stillbirth is also known as IUFD, which stands for intrauterine fetal demise, and it is a rare occurrence. It will affect 1 in 60 births. Some causes can include cord complications, birth defects, small baby or fetal growth restriction, advanced maternal age, high blood pressure, diabetes, infection, multiple gestation or twins, and placental issues like Nikki mentioned.
This is such an unfortunate situation, and the whole care team works to help you through this. We will also provide you with resources like a chaplain or social worker if you want or need it.
There are also support groups that exist, and we encourage you to ask for information if it's something that has not been given to you, because you deserve to have support.
Let's hear what else Nikki has to say about her experience and share with us what it's like being a midwife. What amazing stories that you've shared with us. I want to thank you so much because not everybody goes through what you went through. Not everybody has had a stillbirth or had a child die, and that is very scary, right? It's very traumatizing. But what would be your best advice?
It has informed my practice in such a major way. When that happened, I was a labor and delivery nurse, and I was working at Johns Hopkins at the time. And a few years, so 2 years later, I ended up as a labor and delivery nurse at that same hospital. Now, mind you, this hospital was my growing up, my neighborhood hospital. It was the hospital I was born in. It was 4 blocks from my parents' house. I had such trauma after delivering her there. I couldn't even drive past the hospital. I would go the long route to get to my parents' house. Just young, I was young, so didn't know what to do with the trauma. I didn't, although my mother was a mental health therapist, I didn't seek therapy. I just sort of used my faith to get through it, right? And 2 years after birthing her, I ended up as a labor and delivery nurse at the same hospital. They developed this beautiful new unit. And while I was there, as soon as I got there, they all remembered me, which was mind blowing, right? And then they asked me if I would head the bereavement program for the women who had, suffered any sort of loss there at the hospital. And in doing so, I did that for 4 years. In doing so, I'm supposed to be helping these women. So like I went through like a whole bereavement training. I'm supposed to be helping these women, but little did they know, less did they know that they helped me. It was very therapeutic for me to be able to pour into them because I, was not only in this sympathy mode, it was total empathy. I could feel what they had gone through, right? So that was a gift for me. That was how I got my healing, honestly. And so moving forward, it definitely informs my practice because I think I might be a little more aggressive with teaching people about like fetal movements and kick counts. But also for women who have suffered any kind of loss, though it takes me through my process again, it also allows me to still very much so pour into them in a way that they need, because I don't know if anybody really poured into me in that way in that moment, right? In that immediate phase of when it's happening. So I feel like it's a gift that God has given me, although she was perfect. I was healthy, right? And for at least a year or two, I tried to find this path. Like, why did that happen? Because I didn't have like a medical reason or whatever. So then God sort of gave me this spiritual reason that I'm sorry you had to go through this, but you are going to be able to help so many women with your story and help so many women just get through, right? And know that they can come out on the other side and that you will smile again. Sorry. Yeah, you will smile again. Got emotional. I didn't want to.
Yeah, what an amazing gift that you give to women who are going through such an emotional time. Not even just emotional, but like it really can really influence just someone's perspective on life, on bringing life into this world. And it's a lot of things that people can't relate to because most people haven't gone through that type of loss. So I think that you are in such a unique role where you yourself experienced it, but you also have the obstetric knowledge. And so it's just such a gift that you are providing to the women that you have the opportunity to interact with.
Yeah.
Can you tell us a little bit about the process of how you actually, like your training to become a midwife?
In most states, you must become a nurse before becoming a midwife. I became a nurse. So I went to nursing school right after I had my oldest son. So I went into nursing knowing that I would become a midwife. I worked in nursing for 10 years though, because I was sort of busy raising and birthing children in that process. High risk OB background is from labor and delivery nursing at two like very high risk hospitals. And then I became a midwife, and the healthy, normal, physiologic birth come to fruition was amazing to me during my midwifery education. And then I trained in the birth center. I trained in a fast-paced, high birth volume hospital. And so this was just, it was a very rich training that I got, and that was a 2-year program. And then eventually, like I said, I got the doctorate in midwifery.
Can you explain to us and to the listeners, like what's the role of a midwife? Like what role do they does that entail, and how does that differ from other healthcare providers in the same field of obstetrics, right?
Right. So I get asked all the time, are you an OBGYN? Are you a doula? And these are all birth workers, right, that have different roles, paths of education, different things that they do in the birth world. So how I differ from an OBGYN is OBGYNs are physicians who, as you know, you go to medical school, you do a residency, some do fellowships, And you are trained and educated to obviously do normal births, but you also do very high risk, medically complicated pregnancy, birth, GYN, all the things, right? And surgery. The only surgery that I personally do is circumcision. But other midwives do biopsies and colposcopies and things like that. So, but we differ from physicians in training. A doula is a person who is trained to coach a birthing person through their pregnancy, labor, and even postpartum phase. But they are not medical professionals. They don't give medical advice, or they shouldn't give medical advice. In most cases, they are wonderful coaches and even advocates during the birthing process for the birthing person. There are even different types of midwives, right? So I am a certified nurse midwife. And in my role, again, like I said, I had to become a nurse first and then a midwife. And I can practice anywhere in the 50 states. Then there's the certified midwife who does not have a nursing degree, might have a degree in psychology. And they, go to a midwifery program and become a certified midwife. We're governed under the same governing body and actually credentialed, take the same exam under the same, exam council. But the difference is those who hold a certified midwife degree can only practice in, I think now it's 11 states, because most states, like I said, they want you to be a nurse first. And then there's the professional midwife, certified professional midwife. Folks who practice with that licensure they cannot practice in a hospital. They are practitioners in home birth or birth center birth. They go through a course that I believe is 2 to 3 years, go to a school for about 2 to 3 years where they do an apprenticeship and, they capture a certain amount of births, and then they take an exam through their governing board and become certified professional midwives. But again, they cannot practice in the hospital. They do not have prescriptive authority. And then there are women and men, I suppose, that are just apprenticed by another midwife, probably sort of how my great grandmother did, where she learned from someone and it, passed it on. But they are often called lay midwives or grand midwives, as I like to call them, but they're not legally allowed to practice. So a lot of times it's kind of covert.
So as you can see, there are multiple providers who can provide care for you during your pregnancy and delivery process.
Just to recap, there's doulas who provide prenatal, labor, and postpartum support. There's midwives who provide prenatal care and can deliver your baby. However, keep in mind that some can only deliver your baby at home or at a birth center, while others can deliver you in any setting, including a hospital. Then lastly, there's OBGYNs who provide prenatal care and can deliver your baby, whether it's through a vaginal delivery, an operative vaginal delivery, like a vacuum or forceps, or a C-section.
Now let's get back to Nikki as she shares more information about midwives. Thank you so much for breaking that down. I've heard it many times, but every time I learn something new and I understand it a little bit better. Because there are so many people that can support women through the birthing process. So it's important to know who are all the different players and what are their pathways to this moment of helping someone through the birth experience. So I wanted to ask you, for women who are expecting or expectant mothers and are considering all of those different options, between a physician, OBGYN, a certified nurse midwife, what are the benefits of midwife-led birth experiences?
Yeah, that's good. So midwives are the masters, the gurus of normal physiologic birth, right? So if you are someone who you're super healthy, you have no pre-existing conditions going into your pregnancy, you're very low risk going into pregnancy. So that would be a tight window of people, right? Because Everybody's coming in with something: obesity, advanced maternal age. Like you were told once that you have a few high blood pressures, right? But I feel like for most women now, you can seek a midwife and be sort of triaged to see if you are appropriate for a midwife. And then you also have to ask yourself, like, do I want to birth in a hospital? Do I want to birth at home? Do I want to birth in a birth center? That will be the determining factor, I think, as to whether or not you want to seek midwifery care, because we do practice in all settings. I right now am only practicing in a hospital, but before I moved out here to California, I had a very successful home birth practice in Maryland, in Baltimore. So I think an individual should ask yourself questions like, do I want a natural birth? Am I the person that's like, nope, sign me up for that epidural immediately, like ASAP, stat. You don't want to do a birth center birth. I think it's important for people to evaluate themselves in seeking which route they want to go.
So when you think about like a typical appointment that you might have with a patient, can you take us through like what are the key things that you do in appointments with patients, kind of help them through their pregnancy and their birth journey?
I have certain requirements, like I'm not rushing through visits. So this sort of appointment is going to be this amount of time. Like you're not going to shortchange me and give me an initial an initial pregnancy visit and tell me that I need to do it in 30 minutes. Nope, not happening. So it's a requirement that first of all I get an hour, like an initial OB visit, right? It's an hour long. The patient is triaged by my nurse and she gives me a little background information, but I've already sort of studied this patient: medical history, surgical history, gyne history, OB history. So I know those things when I'm walking in the room. I know roughly approximately like how far along they are based on their last menstrual period. And so when I'm walking in, I don't have to ask a tremendous amount of questions. It's just sort of like clarification questions. And then I open a space for it at that point in time for initial questions. So I walk them through the gray folder, which is super educational. And oftentimes many of their questions are answered out the break from the birthing, the folder that we give them. And just so folks who are listening who don't know what the folder is, the folder goes over like, what can I eat? What can I not eat? What medications are safe to take if I have a headache? If I have insomnia, if my allergies are acting up, like all that's page 9, right? And then there's a breakdown of who are you going to be seeing during your pregnancy and what are our individual like birth philosophies. What are our backgrounds and our birth philosophies? There's a huge like entire one sheet page on what is a midwife, because again, being a unicorn, a lot of people don't know. So it breaks it down. Like that's page 1. Out the break, they get that education. So and then there's like what to expect each trimester, including your postpartum phase. When should I submit disability forms? I mean, it's very well broken down. And so I sort of like highlight the book, and then we do the wonderful physical exam, which includes an ultrasound, which is always so exciting for the family. But it never gets old for me. It's like every time, like delivering a baby never gets old for me, but like the ultrasound and seeing this new little nugget and the heartbeat and the movement, it's just like, it never gets old. And so that's always like the highlight of my day. And there's like 30 minutes of what are your questions, right? And I just offer that space for the patient and the partner or whomever's in the room to just ask whatever questions they need. I think that's important, especially with Black and brown women, where that a lot of the morbidities and mortalities that happen in disparate numbers in these communities happen because they are not heard. And I can attest to me personally not being heard, but because I know how to navigate the system, I'm heard, right? But folks who do not know how to navigate the system are not heard. And so things get missed. I pride myself in listening. I talk a lot too, but I listen a lot as well. Because you got to talk to share information, right? And then that way that person can be the best consumer because they're very well educated and they can make appropriate choices, and then they can make an informed decision based on the information given.
I think you already answered my question that I had next. And it was about the inherent unpredictability of labor and delivery, right? There's so many different scenarios that could happen. It's hard for someone to kind of know what, if this, then that, if that, then I'll do this. So how do you ensure that your patients feel empowered and informed to be able to give informed consent, during the laboring process that in of itself is sometimes can be complicated and sometimes can be what one is not expecting.
I'm a very direct person, so I will information share concisely in that like emergent moment when okay, I'm seeing repetitive decels and we're remote from delivery. I'm very concise. This is what's happening. We've tried this, we've tried that, we've tried this, and it is not working. I'm calling my colleague and because I believe that the best thing for you is to have a C-section. What do you think? It's it like I try not to be manipulative, but like I have to state the facts, right? And I've already like started working in the background, like getting all the folks in play, but I want her to see, okay, this is what's happening, and here, if okay, if we don't, then there's the potential for the situation to get much worse. So I believe being direct, honest, concise, but meanwhile already like working in the background, anesthesia's on the way, my backup physician is on the way, my nurses are already like pulling things down and things, but just giving that woman the information and then letting her make the choice is so optimal. And that goes across the board. That could be for anything. Like we have patients all the time that are like, no, I don't want my water broken. And I'm like, in my mind, I'm like, if you let me break your water, we'll have this baby in like 17 minutes, but, and your pressure will be relieved. Right. So, but I just kind of, again, if you don't want that, that's your body, your choice. And that's not something that immediately needs to be done, but dang it, it would make the process like, it would relieve your pressure and just make the process quicker. But I'm on your time, baby. I'm right here with you. So yeah, and I think that's what midwives do. It's like, you know, we're going to be there, whatever choice you make, right? Because it's your body, your choice. And I know personally, I'm a huge proponent for respectful maternity care. I'm not touching you without your consent. I'm not allowing anybody else. I'm kind of protective. I'm not allowing anyone else to touch you without your consent. So I think that's a gift that midwives give and often share when we're teaching, because I've taught many OB residents and pray that they're out there still using the tools.
I just want to take a moment to co sign what Nikki just said. Your body, your choice. Our job as OB providers is to work as a team to make sure you have a healthy and happy delivery.
As we often say on this podcast, we want women of color to have the births not only that they want, but they deserve. Ultimately, we want you to have a provider like Nikki.
But if you don't, we hope that we can empower you to have the information you need to accomplish your goal anyway. Okay, let's hear what information Nikki wants to leave us with. We know all the things that you can offer and contribute to a patient's care. And in that vein, I wanted to ask you to share, like, what's your approach to pain management during labor and birth? And how do you counsel someone who is seeking a natural
Yeah.
childbirth
Honestly,
experience?
that's one of those questions that I start asking early in the second trimester. Like, how do you foresee your birth process, right? Because you have to know yourself. And I just get their juices flowing because they don't know, right? A lot of times. Or maybe they've had a previous birth and they're like, I absolutely want to try a natural birth. I don't want to do an epidural. Or they're like, oh, that epidural was amazing. I'm going right for it. So I'm, first of all, just getting people's like thought process going on what do you want to do, right? you know your own, maybe you don't know your own pain threshold. So let's start evaluating that now. And I also share lots of tools, like if they're committed to like a natural, unmedicated birth, um, I share with them, okay, well, we need to start figuring out some things. So I share with them some of the things that I do, or I have done. So hypnobirthing, aromatherapy, having a doula, who can, provide all of the tools that they have in their toolbox. There's like taking childbirth education classes. Then there's Lamaze, the old school Lamaze. There's the Bradley method, where the partner is like the support person that navigate their labor. So I just share the tools, and then they can make an informed decision on, yeah, all of that sounds like I'm not even with it. I'm gonna go ahead and run that epidural for me, please, right? So, or they're like, oh, hypnobirthing sounds amazing. Let me sign up for a class.
So you brought up that, the topic about the tools that different, people who are part of the birth process have. One thing I really love about midwives is that if there is a labor that just seems like it's not really progressing, or the baby's not positioned well or something, the midwife knows exactly what to do. So, are there any particular like tips that you utilize during when you're managing labor, that you would be happy to share with our listeners? Because some people may not have the privilege of being taken care of a midwife, but at least to like just know some information that if it did happen in their labor, that they could like collaboratively share with their birthing team to maybe help them in their process.
Yeah, absolutely. So I mean, it's multifaceted. So if there's a birthing person who doesn't have an epidural, right? I strongly encourage movement. The birthing person has an epidural, though we're limited in that movement in the bed, not being flat on your back, using the peanut ball, which is a peanut shaped balloon sort of ball that if you place a birthing person on their side, but almost one leg is up on the balloon, and it sort of forces a long arc rotation on a baby that is OP or facing up. I'm a huge proponent of the peanut ball, but I mean there's so many tricks and tools. I talk to the babies as well. I do. I welcome them. I keep the lights dim. I keep the noise level down, because I'm always like, if I was a baby, I'm not going out into that cold, bright, noisy situation, right? And people sound like anxious and whatever. So I really just talk to the babies. I touch the birthing person's belly, and really just sort of, I mean, it might be a spiritual connection, but I really invite the baby, like it's okay, like it's cool to come out here. You're coming out to love, right?
When people ask me the benefit of a midwife, I tell them they are the experts in vaginal birth. Can you share with some people, like, what are some misconceptions that people have about midwifery that you encounter, and like, how do you address them?
Like the education part has been a huge misconception. Like what type of education did you get? What sort of training did you get? Like in essence, just to become a midwife, a certified midwife or a certified nurse midwife in this country, you're going through at least 6 years of training and education, right? But then the other misconception is that a lot of people think that we only do home birth, which I mean, yeah, I mean, cool. Like during the pandemic, that was my jam. I had a very successful home birth practice. Um, but I also, this is, I think, the biggest misconception is that I can care for a high risk patient. I co manage, right? Because I always, in practice, have a backup position. So I can manage high risk. And one of the, I think, gifts that God has given me as well is this keen sense of when things are turning the corner towards high risk. I love normal, but I know when it's not normal, and when I need to confer with my colleagues and hand off.
What I'm most happy about this whole conversation that we've had is that for our listeners to get a glimpse to know that there are providers out there in the community that can meet their needs, that they can have the type of birth experience that they want. It may not, everything may not go exactly as planned, but the intention, the knowledge, it's all there. So really like seeking out those providers that align with your philosophy, your goals, and most importantly, that you feel comfortable with, because that's how people I feel like have safer birth experiences because they can speak up, they can ask those questions. Um, I wanted to know, are there any other words of advice or anything else you want to share with the Birth Squad?
Yes. First of all, I'm just so happy that you guys have invited me to have this conversation about midwifery. I think collaboration between OBGYN physicians and midwifery is such a beautiful thing. So, like, having this connectivity is such a beautiful thing, and I just hope that there is more of it, because there seems to be such a separation, especially with midwives that work in the community versus the hospital. So I think it's one of the gifts that we have in our practice is that we do invite partnership with community midwives, right? And so that they do have a backup place to go if they're in the community delivering and things get rough or they need to transfer the patient, right? We do have that privilege of sharing this collaboration. So I just wish that there was more of it. And that's kind of what I wanted to share with the Birth Squad. But thank you guys so much for this opportunity to speak on what midwifery is, and to highlight that, yeah, there are a few of us unicorn Black midwives out there doing the work and loving it.
So again, thank you so much. We want to ask, where can the listeners find more information about you and your services? How can they get in touch with you?
Reach me at USC Verdugo Hills Hospital. The phone number is 818-658-5980. I will say that again. It's 818-658-5980. You can also reach me directly. I'm one of those people, like, I'm cool if you email me. So Dr. Nikki, CNM at gmail.com. So that's DRNIKKICNM at gmail.com.
Thank you so much. You have been amazing. I've learned so much from you today. And I just really appreciate you being here with us and sharing all of your knowledge.
Thank you, ladies, so much. I appreciate you guys.
That's the wrap of this episode of The Birth Squad.
Thank you so much for joining us this week. We are going to continue sharing stories from more badass birth warriors, because at the end of the day, you are the experts of your experience. And we want to highlight you and your bold, brave, and beautiful journey to motherhood.
And we want to hear from you. Tell us about what topics you'd like to hear more about. Hit us up on Instagram at The Birth Squad. And check out our website, thebirthsquad.com.
Most importantly, be sure to share this episode with your squad.
Until next time, I'm Dr. Ijama Ogwandu.
And I'm Dr. Kamisha Thomas.
Peace, love, and solidarity from the Birth Squad.